everyone. Of course, it's your girl Lydia Patel for another episode right here. And today we're live and direct at American Dental because we're going into 2011 and we want to talk about oral hygiene, the importance of it, because you all have to keep your teeth clean, got to get the pretty smiles. And that's exactly what I'm going to be getting today. I'm going to get some services done. I'm going to get my teeth whitened, and we're going to go through some of the steps, let you know, one, some of the myths about oral hygiene that we all have to know about because it's extremely important. And there's some pros and cons, and we want to get you all at home up to date on how to get your smile just right. So I'm here at American Dental, and I've got Yesenia, who's here with me, who's actually going to give me a little walkthrough and show us what it's all about.
Thank you, Lydia, for taking a tour of the office so we can show you all the services here that we offer at American Dental.
Well, I'm really excited because you know what? People have to get their teeth clean. They don't understand the importance. And for everybody at home, it's not just once a year, but it's twice a year at a minimum that you have to get your teeth clean. So we're going to get all the details from Dr. Phil and Dr. Watkins. We're going to let you all know all the tips about keeping your teeth clean and whatnot. But right now, we're live and direct. I want to see all the juice, everything that's going on. It's so interesting. So why don't you show us what's going on?
This is the hygiene area. We have our hygienist that normally, and she also, if she sees anything that's going on, she refers them to the doctor. And right now, Diane is doing a routine cleaning, and we recommend all of our patients to do their cleanings at least twice a year. If they need perio work, they need to do it every 3 months.
So you brought up a very excellent point, Yesenia. You mentioned something about perio work that should be done every 3 months. What is that exactly?
Perio work is basically when a person has a condition of the gums and they require extra attention to their gums. And what we recommend the patients to do is to get their cleanings every 3 months to help maintain and make sure that they at least control the issues that's happening with their gums.
And what about children? How often should children get their teeth cleaned?
Well, children normally see the pediatric dentist twice a year, unless they have another condition, but their pediatric dentist will let them know if they need additional cleanings. Well, this is Dr. Joseph. Dr. Joseph takes care of all of our root canal patients.
Explain to us and elaborate a little bit. I know you do root canals. What exactly is a root canal? We hear that word so often, but what exactly is a root canal?
Back days, the root canal was, when you hear it, that's painful. But nowadays, by the technology and all the advanced information, that we could make it as simple in one visit and painless by, new technology with that. And at the same time, the patients benefit from that. Is not anymore scared from what is called root canal.
So from a medical standpoint, Dr. Joseph, what's the pros and cons versus keeping the tooth in and having a tooth removed?
Oh, really? It's a big difference when you have a teeth you could chew and eat, feed your body. That's a big difference rather than back days when we pull it. When we pull it, you end up by denture. Sometimes they have a lot of problems with the prosthesis. But root canals now, like I said, it's become easier, and we have your own teeth. And that's much better than the artificial prosthesis.
I am so passionate about dentistry because now is the time to go to the dentist. Now is exactly the right time for everybody to start taking much better care of their teeth and to prevent all of the dental problems because we know how to do that now.
And that's very true. And there's actually a couple of different myths, and we're going to touch upon that because you were saying that statistically only 50% of New Yorkers visit the dentist. So that's kind of scary. So why don't you tell us about that?
Yeah, it's kind of too bad. Only half the people in our wonderful city here get to go to the dentist on a regular basis. And the main reason for that is fear. And there's two fears that we deal with. One is the fear of people thinking that it's going to hurt if they go to the dentist. And the other fear is the fear that it's going to cost too much to go to the dentist. And with modern dentistry, we've taken care of both fears. It doesn't hurt anymore. We have modern methods to take away the pain so that you don't feel any pain. And now with the dental insurances and the special dental plans that we have, dentistry is affordable. What we've done here is we've created what's called a dental super center. And I think you've seen some of that on today's filming. It's where you have dentists of all different kinds and specialties practicing together. So you have the orthodontist and the periodontist and you have the root canal specialist and the oral surgeon all practicing together, sharing the overhead, and that brings the cost down, and we pass that on to you. But the main benefit is that you as a patient get to have several opinions all at the same time. So if I, as a general dentist, said, I think you need to see the oral surgeon, I can bring in the oral surgeon. You can get his opinion. You can get my opinion. You don't have to travel across town, and you don't have to wait, because when we tell somebody they may need to see a surgeon, they get worried. And so we try to take the worry out of it right away.
Now, let's say for people who have had cavities, and what is the result of leaving a cavity?
Well, it's kind of like everything in the human body. Little problems become big problems if you don't take care of it. So if you have a little cavity, come into the dental office, get that little cavity taken care of, get that little cavity filled, where we take the germs. A cavity, by the way, is just an infection in the tooth. Now, if you had an infection in your arm, wouldn't you take care of it? You'd put some medicine on it, you go to the doctor, take care of that. Same thing. If you have an infection in the tooth, you want to have the infection removed, filled in, so that the tooth is restored back to its natural morphology, its natural anatomy, and then you're fine. If you ignore it, it's just like any infection. The infection is going to get deeper, 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 bigger and bigger and bigger, until, it hits the nerve. And then we get that classic toothache. And now what's happening is, remember, the teeth are in the gums, in the bone, in our body. It starts to spread throughout the whole body. So again, take care of those cavities when they're little, they're easy. Before it goes into the nerve, you may lose a tooth, it may make you sick. It's going to weaken you. It's going to make you more tired than you need to be. Just take care of the problems when they're little.
Well, everybody, I told you it is my turn to be in the hot seat. I am in the hot seat. I'm about to get my teeth whitened. But first, I have to have a little one-on-one, of course, with Dr. Watkins. Welcome to the program.
Thank you very much.
So tell us about yourself. I hear that you're a super doctor, a super dentist, as referred by Dr. Phil. What does all that entail? And tell us about yourself.
Well, Lydia, if I may, Ms. Patel, I appreciate that designation, but I'm humbled to be able to have, I guess, acquired some skills in dentistry, which allow me to do various things. I guess the quintessential general dentist, even though my training is as a specialist in orthodontics. I have had the specialty training, so that's really my area. However, I did not put aside my general dentistry training that I got at Meharry Medical College in Nashville, Tennessee, which means that I have the good fortune of being familiar with most phases of dentistry, which helps me in educating patients with regard to their full mouth rehabilitation. We can talk about implants, we can talk about orthodontics, we can talk about tooth replacement, we can talk about whitening, we can talk about all things, and therefore a patient gets a chance to get an idea of what they may need in order to be able to get things done in their oral cavity.
And speaking about what people may need, you've actually traveled to poverty-instructed countries and done work over there, which is absolutely fabulous. So you've offered your services. Why don't you share that with us?
Well, that's very kind of you to recognize that, and again, I'm humbled. It's not something that is anything more than a duty. I've been very fortunate. In 1990, one of my friends said, "Do you want to go to the Consulate General's office for Jamaica in Manhattan?" When I was an orthodontic resident at NYU, and I said, "Sure." What they were talking about then was starting a program to go back to Jamaica to do some volunteer work in some of the impoverished areas. Since that time, and I guess that's 20 years, I have done annual trips every year for the past 20 years to Jamaica, to Ghana, to Ethiopia, and to India. And in all those cases, a team of physicians, dentists, nurses, and other interested individuals associated with a group called the OID, Organization for International Development, which is a nonprofit, actually based here in New York. We go to these various areas and provide, in my case, basic dentistry, mostly as extractions. And I will tell you that even though it may seem not that significant, a bad tooth affects the way you eat, affects the way you speak, affects your whole life. So coming to some of these countries and one person saying, just right there, this might be a tooth that's just waving for an old person, getting that tooth out really helps them quite a bit. So it's a good opportunity to go in and actually affect a change.
I'm about to get my teeth whitened. Why don't you tell everybody at home about the pros and cons? Because there's a lot of myths. Some people think, one, that it hurts to get your teeth whitened. I would not be here if it hurt. So Dr. Watkins, thank you for letting me and reassuring me that one, it doesn't hurt. But why don't you tell us about the whole process and exactly what we're going to go through?
Well, basically what happens with whitening. Whitening, as some people believe, of course, does give us an aesthetic result. that is, of course, makes our smile brighter. And of course, in America, that is important for what we see on television and all the advertisement. But one thing is an interesting fact, whitening that does not hurt, is one of the few medical procedures that men actually embrace more so than women. You know, men are typically the ones least likely to go to the doctor, to the dentist, whereas in the situation where whitening takes place, men actually are more inclined to get their teeth whitened. Why? Well, chances are you're going to get a better job. You're going to have a better opportunity if you have a nice smile. At least, of course, in America. So we give the individuals a chance to sort of improve their self-esteem, improve their image, and of course improve their health. Because what happens, of course, is that you can't really whiten teeth that are not healthy. So the first thing we have to do, we have to make the teeth are healthy, which means the patient comes in with the idea, wow, I want my teeth to look better. But what we get to do as clinicians is we get a chance to educate the patient on getting ideas of periodontal disease or gum disease, restorative aspects, and that sort of thing. And therefore, they have to have everything basically disease-free before we actually go to the point of actually whitening. So it's our way of motivating people to come in for a purpose that may not seem that significant in terms of whitening, but it gives us a chance to really improve their overall oral health.
And I'm about to get started here. Dr. Watkins is going to do the Zoom whitening on me. So everybody, I'm going to sit back, I'm going to strap in, and then when we come back, I'm going to leave with a brighter smile.
Okay, Lydia, you are actually in the position where you would be when you go through a Zoom bleaching. And you're doing very well. I hope you're okay. Mm-hmm. You look like you're just so relaxed, but then you're such a professional. Now, what I am first doing, even before we had this session, you recall that I examined your teeth. And I've examined your teeth, and of course, you're cavity-free, and you have very good hygiene. That's very important. What I've done, as you can probably tell we did before we started, was I have retracted your soft tissues because we don't want your gums or tongue in the way. Remember, this is a whitening material, and it works fairly well. In fact, if it got on your clothes, you'd have a spot on your clothes. So we don't want it to get on any soft tissue. It should be only on the hard tissue, only on the tooth surfaces. For that reason, we have everything retracted out of the way safely. Bear in mind that people who have certain kinds of habits will have greater benefits than others. For example, coffee drinkers, tea drinkers, individuals that eat a lot of curry, or some of the other staining foods, grape juice even, will have a tendency to have some darkening of the teeth, and of course smokers. Those individuals will see the most dramatic change. Those individuals that don't drink a lot of coffee and that sort of thing, well, you know, they'll have some changes that are going to be a little less dramatic.
Well, everybody, I'm about to unveil my brand new white teeth. I haven't even seen them yet, but of course, Dr. Watkins has hooked me up, so I'm about to see what it's all about. So any last words? I'm going to let him wrap it up and tell me about the process.
Well, we're very happy with the results. I think that Lydia has gotten a good result. As I indicated before, whitening is something that can be a great booster to self-esteem, not that she needs it, but something that I think we'd like to present for our patients. I'm very pleased with the result, and now I'm going to present her with the mirror. Tell what you think.
Oh, my gosh.
You like that?
I see a huge... I do see them.
That's right.
It's
that's right.
very white. They are very white. It's fabulous. I love it.
Look at those teeth. This is part of the extreme makeover. Not that we needed one for her because she's already very lovely, but certainly something that we can do for our patients and something we'd like to provide here at American Dental in the Bronx.
Well, thank you so much, Dr. Watkins. It's been a fabulous afternoon hanging out here at American Dental in the Bronx. As you can see, I'm still fresh in the chair, but I haven't left the chair yet. But guess what? Thank you so much. I want to thank the entire staff, Dr. Phil, Yesenia, and of course, everybody here at American Dental. It's been a fabulous afternoon, very informative, and I know our listeners and our viewers are definitely going to be coming out and check it. So I'm going to leave you with my smile. Thank you, and we'll be right back with more. Stay with us. Keep it locked right here.